Hello, my name is Angel Boudreau, and today I'll be covering the topic of workplace bullying. What is workplace bullying? Well, workplace bullying is defined as the repeated, unreasonable actions of individuals that is directed toward an employee, which are intended to intimidate, humiliate, degrade, or undermine. This creates a risk to the health and safety of employees, and when an employee health and safety are compromised, patient safety is also in jeopardy. And I'd just like to add that workplace bullying goes a lot further than just your classic bullying. It can include verbal abuse, nonverbal abuse, and it can even be physical. 3 points that I'd like to bring out is that inappropriate workplace behavior, such as workplace bullying, can negatively affect both patient safety and staff member satisfaction. The most effective type of interaction amongst the multidisciplinary team is meaningful communication. When used properly, meaningful communication encourages and contributes to a healthy work environment. And with this said, in the workplace, if there's an issue going on with a coworker concerning any matter, the best way to handle it isn't to be ugly, it's to effectively communicate about it. The cues and competency that I've chosen to cover is teamwork and collaboration. The overall goal of teamwork and collaboration is to function effectively within nursing and interprofessional teams, fostering open communication, shared decision-making, and mutual respect to achieve quality patient care. Self-respect and respect for coworkers and others is key to prevent bullying and other inappropriate workplace behaviors. The BSN Essential that I've chosen to discuss is BSN Essential number 8, which is professionalism and professional values. Professional values are essential to the nursing practice, and I have a quote here. It states, "Human dignity is respect for the inherent worth and uniqueness of individuals and populations. In professional practice, concern for human dignity is reflected when the nurse values and respects all patients and colleagues." In conclusion, workplace bullying and other associated behaviors, such as violence and incivility, are not conducive to an adequate workplace environment. Workplace violence prevention programs should include a zero-tolerance policy for workplace violence, both verbal and nonverbal threats and actions. And I'd also like to add that it's reported that between 2002 and 2013, healthcare workers had 4 times the risk of experiencing a violence-related workplace injury requiring time off from work than individuals in the overall workforce. So that statistic alone is very astonishing. It happens a lot more often than we think it does. In addition to that, this statistic does not include trauma experienced from verbal and less severe physical abuse. And also, a lot of incidents go unreported. So just keep that in mind when communicating with your coworkers, and I hope you enjoyed my presentation. These are my references, and thank you for watching.